In the summer of 2013, I began to experience a shooting pain in my right arm. I was having a difficult time holding a golf club. I was losing the strength in my right hand. I went and had an appointment with my internist, who recommended therapy. The therapist suggested injections, pain injections, and it really didn't have the effect that I wanted. Dr. Tortolani recommended surgery, and he explained that there were two ways to do it. One was to fuse the disc, but there was a second method was relatively new, but he had done it successfully, and that was to replace one disc with an artificial disc and then fuse the second disc. Things didn't go as planned. The 2.5-hour surgery took about 5 hours.
While I was sitting there waiting, the attendant asked me to go to a back room and take the phone with me. And I was thinking, oh, he's finished. He just wants to tell me that they're done and he's moving on and, he'll be out shortly. And instead it turned out that he said things weren't going very well.
One of the instruments that he was using malfunctioned and struck my spinal cord.
It was a dire prognosis for quite a while, especially in the beginning, finding out that thinking now he can't move anything from the neck down. And what do you do? What happens at that point?
I lived an active life with backpacking and camping with my wife and my children. I played a lot of sports and coached baseball for 11 years. I joined the police department in 1975, and the last 17 years of my 37-year career I spent with the SWAT team. I've always used to preach to my guys in SWAT that it's adapt and overcome.
Dr. Tortolani explained to me what was happening. He gave me two options, that he could either abort the surgery or he could continue with his new plan. And he wanted my permission to continue, and I said yes.
When I woke up in the recovery room that evening, I learned that I was paralyzed from the neck down.
Dr. Tortolani did come out and sat down and talked to me and explained to me what was going on.
He went way beyond apologizing, way beyond saying that he was sorry.
I know it was very difficult for him, and I was very thankful that he did come out and talk to me, but I could tell for him it was very hard because he had known Jack for a while.
I had always been a fighter, and I told him, I said, let's get the show on the road. Let's figure out what we're going to do and get it started.
I don't remember exactly when I got the call from the risk manager who's on site at the local hospital. But when he called me, the question was, how do we deal with this? What should we do? When you work in an organization where the directive is to do the right thing, the answers are really easy. Tell them basically anything they need is what we're here to give them. We have to support them.
I was shocked personally that the hospital did say something happened on our watch, we want to be responsible for it, and we want to help you in any way we can.
Don't worry about it, we'll take care of it. And they did.
The first week Jack was in the hospital, we were supposed to be transferred to Good Sam Rehab, and we found out that our insurance was not going to pay for acute rehab, and immediately the discharge planner told us that MedStar had decided that they were going to pick up the tab for that, not to worry about it, that we were going to transfer him and get him the help he needed.
I went in the hospital as a patient, and then I became a victim, and that's not right. As a victim, the early intervention allows the victim/patient to get on with their life a little quicker.
If we're there in the very beginning, we can make sure they have home health aid. They have somebody in the house to take care of them. They have attendants if they need to, somebody to take care of their needs. That all can be done in the very beginning. In the old traditional way, I'm just looking at picking up the pieces after everything has been broken. In the new way, we're looking at taking those pieces and making sure they're melded together to get the patient the best outcome possible.
MedStar did it all. They did emotional support, they did physical support, and they did monetary support. I think all of those things together are what's going to make it a success.
It was one less thing I had to worry about. It allowed me to concentrate on getting better. That just made life a lot easier for me.